Ambulance services, patient breathing.
They don't know if he's breathing and he's not waking or...
They can't get him up. Now his whole body is shaking.
A leg is severe sliced open. It's horrendous.
RTC!
This is a typical 12-hour shift with West Midlands Ambulance Service.
It's not like a normal job.
Nice and steady.
What's going on?
In that time,
Stop.
it receives over 2,000 calls for help.
Does she still have the knife on her?
I'm staying right here with you until we get the ambulance there, OK?
From a population of 5.6 million,
You are with people for the best and worst moments of their lives.
Can you lift this leg for me?
Anything like this happened to you before?
You might have broken it, you might have dislocated it.
filming simultaneously with 7 paramedic crews.
Oh, sounds nasty. Yeah, Roger, we're on the way.
But don't be afraid to call us, please.
This is life on the front line.
I'm back.
If we don't get to a patient on time, it can cost lives.
With the sun up and most people still in bed, the paramedics of West Midlands Ambulance Service clock on.
Oh, lovely morning.
It is. It's a very lovely morning.
Good morning, 4831 booking on duty at Stoke. It's Dave Lee and Mick Seal till 6:30 this evening.
Out on the road, the crews will spend 12 hours together. But for some, that's nothing compared to how long they spend with their mobiles.
How much time do you reckon you spend on your phone a day?
Oh, I don't know. Probably not as much as what you think.
I probably spend more time on my phone.
You do?
It's marketplace. I like a bargain, me.
Yeah.
Bargain hunter.
That's why you got me. I'm a bargain.
I also use it for learning Spanish as well.
Learning Spanish.
Hola, buenos días, ¿cómo está?
Dos polo, la cuenta, por favor. I'll have 2 chickens in the bill,
2
please.
chickens.
And after a long day at work, there's nothing better than kicking back and watching cat videos.
To be fair, I think we actually spend more time
We watch them together.
Like watching the phone and being like, oh, that's a nice video.
That wet stuff.
Is that wet stuff?
All that nice view's disappeared.
It has a bit. Just got this lovely view now. Water.
Bet the ducks all live in it.
Hope this rain stops before we get there. I'm going to get my hair wet otherwise.
Yeah, it'd go curly.
Oh, I won't be able to do anything, would it?
Oh, but it goes frizzy.
Goes frizzy.
Oh, when it rains, it's murder. Wind and rain, frizzy air. Can't do a thing with it.
Nope.
Ambulance service, is the patient breathing?
The breathing, she's had a slip and she's cut her leg open very badly.
Okay.
Her leg is severely sliced open, like the muscles on show. It's horrendous.
4831.
831, thank you. If we go to the 72-year-old trauma case, the skin of the calf has been degloved, muscles are showing, wound approximately 10 inches wide.
Oh, sounds nasty. Yeah, Roger, we're on the way.
A degloving injury is where the top layers of skin are torn away from the underlying tissue. As it typically involves severe blood loss, it's often life-threatening.
Right, your left is clear.
Cheers. Isn't very often you get sorts of traumatic injuries on a golf club.
No.
It's normally something like a cardiac arrest. It's tight.
Thank you. At least they've straight down there, mate.
Where about? No.
Straight down.
Thank you.
Thank you.
First tee.
We don't move.
No, that's fine.
Bandage onto the flat.
Yep.
The patient's fellow golfers have been taking care of her.
Look at you guys.
Hi, all right. Hello there.
Hiya, Doc. My name's Dave and this is Mick, all right. Right.
Cocodamol.
What time?
What time?
3500 about 20 minutes ago.
Thank you very much.
72-year-old Pat fell awkwardly down a slope. breaking the fall with her hand and scraping her leg on a low wall.
Have you got any pain in your neck or your back at all?
No.
No, all right. You remember everything that happened?
Yeah.
Not knocked unconscious at all?
No.
Luckily, she's not knocked herself out. She's not been unconscious. So I'm not overly concerned that she's hit her head, which, from where she had tumbled, was very, very lucky.
I was using my club as a walking stick. And...
Well, there's your problem, using your club as a walking stick.
Yeah,
right. I'm going to have a quick feel of your neck and your back just to make sure that's okay.
Dave needs to rule out any kind of spinal injury before they can attempt to move Pat.
All right. Any pain in your hips at all?
No.
No. Oh, right.
My chin, my chest.
Yeah, so you got a little bit of a graze on your chin there.
An air ambulance has been sent in case Pat needs to be airlifted to hospital.
You're not putting me in there, are you?
Sometimes you just tend to send it because of where we are.
Oh, dear.
Just wait for my colleague to come back and we'll have a look at this and we'll try and get you sorted and get you shifted, all right?
Okay.
Right, no C-spine, no hip, no back pain.
Okay.
We're a bit hypertensive, 170 over 110, but I'm not surprised.
Not surprised. Right, what I need to do is move this leg out the way if we can so I can get your other leg straight.
Yeah.
Any pain in your knee at all? Just take your time for me. Take your time. Swap legs for me. That's it. Bring this leg right nice around for me.
You're doing brilliant.
Lovely.
So fantastic, that is.
Oh, well, it is.
Okay, right, hang on a minute. Is it painful or is it sore?
Stinging.
It's stinging.
Yeah.
All right.
Satisfied that Pat hasn't injured her spine, Dave and Mick now need to remove the temporary dressing on her injured leg.
Bystanders had actually dressed and put a makeshift bandage over the wound itself. We needed to get back down to skin level to have a look at the wound to make sure there was no debris in there to wash it out to reduce the infection risks. How are we doing?
Oh, God. Yeah, there is.
Yeah, keep coming round. Yep.
Hey.
My name's Brian, sorry, this is Rob. How are we doing?
Basically, we were going up these steps to have her off the first tee.
Hello, lovely.
She was using a club as a crutch and she's lost the balance.
Mick gently removes the last of the temporary dressing, so the cut to Pat's leg is exposed.
Pat's injury was quite horrible. She's done a massive, what we call a degloving. So it's basically you've dragged your skin all the way off the injured limb.
Oh, it's just hurt my leg. Oh.
Sorry.
What are you doing food-wise? What have you got?
Pasta, mozzarella and pesto.
Are you making it yourself?
Yes. It takes 2 seconds to do now.
Do you put a load of like grease and fat in it like you do with your chips in the fryer? The healthy air fryer that you make unhealthy?
Oh, right.
Your lunches are far too healthy.
What, pesto, pasta and
Yeah, too
mozzarella?
right. There's lots of long words there I don't understand.
It's a tongue twister as well.
To be fair, I think your lunches are pretty healthy. You do try, and then you ruin it with a big burger from a fast food joint somewhere.
Yeah.
Ambulance service. Is the patient breathing?
Yes, he's breathing. He's unconscious.
Is he fighting for breath?
Yeah, he is panting, yes. He went with a crop, he did. They can't get him up. His whole body is shaking, they've just said.
So now he's having a seizure?
Yes.
Right, Amelia, we've got a Category 1 male who's fallen in the garden. The patient's fitting, so obviously potential for traumatic brain injury here if they have hit their head quite badly. If someone's hit their head on something hard, there's risk for traumatic brain injuries, skull fractures, neck and spinal injuries, amongst other injuries as well. Hello, my mate. Right, first things first, mate. Let me have a feel of your wrist quickly. What's your name? David.
63-year-old David was in his garden when he felt dizzy and collapsed. A worried neighbour saw him across the fence and called 999.
Keep your head nice and still for me. Have you bashed your head at all?
No.
Any pain down your neck here, mate?
No.
All right. Any pain anywhere at all?
No.
Did you collapse or did you fall over or?
I can't remember.
Can't remember. Well, I was a bit concerned as to why he couldn't remember. Had he fallen and knocked himself out? Has he had a seizure while standing and then fallen? What is the cause of that memory loss? Why can't he remember what's happened? And that's an important piece of the puzzle for me to work out what injuries we might have, what assessments I need to do, where I need to go from there. So have a feel your hips quickly. Any pain in your hips here? No? Any pain in this leg?
It's just a bit when I start shaking.
Okay. Do me a favour, can you bend this knee for me? Good man. And what about this leg? Can you lift this leg for me? If you can't, you can't. Well, can you normally lift this leg up?
Yeah.
Yeah? Okay. Is that painful where I'm touching there?
Open your eyes, sweetheart.
Open your eyes.
It was worrying when David didn't, respond, because it could be due to a number of things, whether it be neurological, respiratory.
Yeah, definitely. It was definitely worrying that he'd been talking to us fairly well up until that point, and then all of a sudden it was just stopped. Open your eyes for me, Max. Right. Look at me a second, look to your right. Just keep your eyes open, I'm just going to shine this light in your eyes, okay? Okay, you've got any headaches at all?
No.
No, do you still feel dizzy at the moment?
Just a bit.
Just a bit. I was concerned that David could have been having a stroke, and one of the tests we carry out to rule a stroke in or out is a fast test. We look at their face, their arms, their speech, to rule out if there is some sort of stroke going on. Do me a favour. I don't get everyone to do this, but I like you. Poke your tongue out at me. Poke your tongue all the way out. Literally, look at me, all the way out, listen. That's it. Can you move it to the left for me? And the right. Can you move it to the right? Okay, and relax.
If David can't control the movement of his tongue, it could suggest he's had a stroke.
Did you feel unwell when you fell?
I felt dizzy.
Felt dizzy? Okay.
Excuse me. Hiya. Do you know roughly what time he fell?
It was over an hour ago.
Over an hour ago.
I said, "Are you all right, David?"
Yeah.
Next minute he fell.
Okay, and when he was on the floor, was he talking to you straight away?
No.
How long was he sort of not talking to you?
20 minutes.
All right, but I think we need a trip to the hospital, okay? So I'm a little bit worried as to how weak you are on this leg, on this side, all right? And with the dizziness, I can't rule out there's something going on neurologically in your brain. Have you ever had seizures before or anything?
Probably, because tablets are all in that cupboard.
Can we have a look on your doctor's notes?
Yeah.
Yeah? Cool. Ah, so you've got seizure disorder.
David's records show he has a complicated medical history, including seizures.
So the big issue we had with David was that his medical records were vague, so we couldn't give him the medication which we carry for seizures because his medical records had a very vague allergy to epilepsy medication, so it really left us in a conundrum as to what to do, how to treat him, because we don't know what he's allergic to. Let's get you off the floor and out of this heat, because it's absolutely sweltering out here. Ready, steady, roll. There we go.
Steady, lift.
I'll see you, Dave. You get better.
Okay, thank you, Doreen.
He said thanks, Doreen.
Couple of bumps, mate. Is anywhere hurting now we've moved you?
Just the bottom of the back.
The bottom of your back? Is it because of is it since you've been on this hard board?
I don't know.
Right, we're going to just log roll you. Okay, sweetheart. Ready, steady, roll. Is that hurting? Yeah.
Central spine.
Yep.
So we got David onto the back of the ambulance. He was complaining of lower back pain, so we just rolled him over to check to see where that pain was. He was complaining that it was on his spine. So at that point we were concerned for a spinal injury. David, what I'm going to do, mate, we're going to have to leave you on this really hard board, because where that pain is right in the centre of your spine, so you need a scan to rule out any damage to your back. Okay, so are you happy if I pop a needle into your hand or arm? We'll give you some pain relief.
Not very good with needles.
You can hold my hand if you want, sweetheart.
This is the paracetamol about to start now, okay? Hopefully this will start helping with the pain.
Nigel gives David liquid paracetamol intravenously. This should help relieve his pain.
How do you feel?
Bit drowsy.
Bit drowsy. How's that pain in your back? Is it better since I give you that paracetamol?
Yeah.
Good. How long have you lived there for? 12 years. You've got a good set of neighbours, haven't you?
Yeah.
You're lucky you got good neighbours looking out for you. You okay, David? David! 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 Amelia, slow down a second.
Suddenly, David begins to choke.
Spit it out, spit it out, spit it out, spit it out.
What are we doing? Nige, do you need me to stop?
I need you in the back, mate. Stop, stop,
Okay,
stop, 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 stop. I need you in the back.
Okay, I'm coming.
Can you cut that top strap off? The bottom strap, sorry.
To the southeast of Stoke, paramedics Amelia and Nigel are with David, who started choking.
Talk to us. Can you get the pads on for me, mate?
Yeah. It's quite rare to stop an ambulance on the way to hospital to support your colleague in the back. We were concerned that his airway might be compromised.
Let's roll you back onto your back, David. He's getting quite braddy though, that was the problem.
Brady, or bradycardia, means David's heart rate is slow.
His heart rate did start to drop, which was a concern. When your heart starts to get very slow, it struggles to pump the blood around the body, and it can become dizzy, it can cause you to pass out. And ultimately, if your heart gets that slow, you will go into cardiac arrest. 87, can we have Red back up to our location, please?
Yes, that's all received, thank you. I'll get you a crew.
Amelia and Nigel urgently need help from another paramedic crew. It's called a Red backup.
Becoming hypotensive. Let's get some fluids up and running. Still got a ready.
Crew, please.
Patient suddenly deteriorated and we need 2 pairs of hands for airway management. Right, we're on pads. Blood pressure at the moment is failing. Open your eyes for me.
Well done.
That's it, good ma'am.
Keep your eyes open.
You okay?
Have you got any chest pain, David?
I wonder if this is what's happened today. I wonder if he's had a seizure, fallen, and that's why they then phoned us, and why he's been unresponsive.
We've got 20 minutes.
20 minutes? Yeah, cancel, we'll go.
The backup crew will take too long to reach Amelia and Nigel. They need to head to hospital now.
You know, his blood pressure was coming up, his heart rate was coming up, and we could actually get going to hospital, which is where we needed to be because we couldn't get to the bottom of why this was happening or what was causing it. You okay? Okay, mate, don't worry too much. We're near at the hospital now.
Just 3 minutes later, Amelia and Nigel arrive at Queen's Hospital in Burton-on-Trent.
You okay, David?
Yeah.
You okay, David? We're just at the hospital now, mate, it's all right.
Neurologists will want to run scans to try to find out why David collapsed today and what can be done to bring his seizures under control.
Turned very quickly, didn't it?
Yeah, I was going to say, it looked like it's going to turn for the worse, really, wasn't it? Because he went downhill quite quick.
Very quickly.
En route
and that
to hospital,
choking
didn't
was
he?
strange. I wonder if they'll get to the bottom of it at the hospital.
He's in the right hands now.
Oh, it's just hurt my leg.
Sorry, is that stinging?
It's just
cold water, sweetheart.
We're basically just giving it a bit of a clean, all right?
At a golf course near Leek in Staffordshire, paramedics Dave and Mick are treating Pat, who's fallen and badly injured her leg. A HeliMed team is also on the scene.
Do we think there's any fractures underlying that wound, or do we think it's just tissue damage?
I think it's tissue damage itself. We had a look at the wound. It was significant. The flesh, the skin had been removed from just below the knee down to the ankle. And it was quite significant, and it can be limb-threatening.
Yeah, you won't be playing golf for the rest of the day. Get this sorted first, OK? I'm going to dress your leg. I'm going to give you some strong stuff to help with that pain, OK? And then we're going to look at moving you and getting you onto the ambulance, all right?
Oh, well, we'll look after you. Don't worry at all. These accidents happen, don't they, unfortunately?
Critical care paramedic Ryan inserts a cannula so Pat can be given morphine directly into her bloodstream.
Just some cold water going to go up your arm, OK?
Now that the wound has been cleaned, Mick can apply a fresh dressing.
It's going to feel cold on your leg now.
Pat, I'm going to lift your leg up now, okay, nice and steady, all right?
Okay.
Just nice.
That's, oh, you've done that yourself, well done.
Perfect, well done.
We've got to get Pat off the floor to get her on to the vehicle. We have to make sure she's calm, relaxed.
Have you actually played yet? You haven't even had... Oh, that's even worse.
That's even worse.
At any point, okay, that you get in serious pain, you need to let us know, okay, and we'll stop and reevaluate.
Now Pat's pain has eased, she can be moved.
How easy was that?
That was easy, yeah.
Ready, set, move.
Beautiful. Have we got the hacksaw?
We tried, we had a little laugh and a little giggle with her, which kept her stress levels quite low and made the job a lot easier.
Okay, Pat?
Confident Pat's injury is not life-threatening. She can travel to hospital by road, leaving the air ambulance crew available for the next emergency.
And we'll click you into here. There you go. Okay.
See you there.
How often do you get out to play golf?
As often as I can.
As often as you can. You've got some good bruising on the inside of your arm as well, and yeah, all around here. You scraped your arm, so you've gone with a proper tumble.
I started staggering forward and hoping that I'd get my balance before I went over the edge, but I didn't. I thought if I could just run down this bank, I might land on the path, and I did. One end on one wall and one end on the other.
I bet the last thing you expected today was to go and play golf and end up in the back of an ambulance.
I still can't believe I've done this.
Well, these things happen.
Pat arrives at Royal Stoke University Hospital, where her injuries will be examined by the trauma team.
Right.
You've done a proper good job on that as well.
What's that?
Chin.
Chin.
Yeah, you can see the bruise coming out now. Okay.
Okay.
Come on in.
Unfortunately, it doesn't look like Pat will be teeing off again anytime soon.
I always said playing golf's a dangerous game, and that just goes to prove it.
Definitely. That was
some deed loving.
That was some injury, that was.
To be honest, she's very, very lucky.
She's calm as well.
It could have been a lot worse.
Oh, look at the sun setting.
The trouble is, it's behind us. We had a really lovely, it was all orangey over here the other morning, our last night shift. That was pretty. It was pretty. Betty. Do you remember that programme?
Mm.
Some mothers do have them.
Mm.
Betty.
I was sort of 10, 11, maybe 12.
So you're trying to say that I'm old? I only know it because of my dad, right? I am young.
I like you got that in there. I am young.
I only just turned 32, so I can't be that old for the programme.
You're-
you saying that
no,
I look
I would
old?
never say that. You look young.
You would never say that I look young.
No, I said you would look young.
Oh. Have you called me old?
That's taken out of context. That's never. So that.
You
is
probably
sort
do
of-
call me old. You should never ask a lady her age anyway. I'm a woman. So never ask me my age again, Tony. I'm a lady. No, I'm probably not.
Ambulance service. Hello, police. Could we have your assistance, please, to a non-responsive male?
So we're not sure if he's breathing unconscious?
Yeah, that's right.
Okay.
He's outside in the doorway. They don't know if he's breathing and he's not waking up.
4716.
The callers are saying don't know if he's breathing or not, but they're not conscious.
Yeah, no, that's all received, thank you. So we've been tasked to a Category 1 call for a patient outside, querying cardiac arrest.
A Category 1 call is given the highest priority, meaning there's an immediate threat to life.
We've got no known age, just that it's a male, but they're in the doorway of a cafe, so
When we get that original information that it's a Cat 1, especially outside, you immediately start thinking of, is it going to be chaos? Is there going to be people around? Is there going to be traffic? And am I driving safe enough to get there in a quick enough time to potentially save a life?
Who knows how long they've been there?
If a patient's in cardiac arrest, if CPR is not being done and a defib's not available, the chances of survival are almost zero.
In the West Midlands, we're following 7 paramedic crews simultaneously as they work a typical 12-hour shift.
If I go in the bus stop here.
In Stoke, paramedics Linda and Tony are responding to a man reported to be in cardiac arrest. They're met by the woman who rang 999.
Hello, is it that young man?
Yeah. He can barely walk. I've managed to get him all.
Okay.
Okay.
I'm just going to go and have a quick wander then.
Okay. Is it the chap in the yellow coat?
Hello?
Right.
Can we just step off this road, sweetheart? Let's get you safe. What's going on?
No.
Have you been asleep?
No,
Do you need an ambulance?
No.
You don't want us?
No, I'm all right.
It's always a relief when we arrive on scene and find that the patient isn't in cardiac arrest. It means that we can take a breath, we can take our time and try and help the patient.
Okay. Just an update on scene, mate. The Cat 1 patient is up and about walking. We believe he's a homeless chap. Linda's just having a chat with him at the side of the road, so all is safe and no other resources needed. Every patient I go to, I try my utmost best to treat everybody the same. I don't know why a person is homeless. I don't understand their dark day. So we need to treat everybody the same, regardless of living requirements, sexuality. Everybody's the same. They all get the same respect and the same treatment.
You always spare blankets, have you?
I genuinely don't think we have at the minute. I'm ever so sorry.
It's all right.
You sure you don't want anything?
No, I'm all right in a minute.
Yeah?
Yeah.
Where are you going to head to?
I'm going to listen.
You're going up that way? You're absolutely certain?
Yeah. It's all right, it's all right.
Take care. Doesn't want us. Yeah, I mean, he's up and walking about. He's obviously asked for a blanket, but we haven't really got any at the minute, unfortunately.
Is there any on the bed? Go down that side, mate. I don't want you to get run over. then it will be a bad day, won't it? All right, mate. All the best, dude. Let me get out of the loop, see if there's one. I want to see if I can get a blanket, see if we've got one.
Oh, there is one.
We're seeing more people being homeless now because they can't afford the bills at home. And it's a bit heart-wrenching when they've asked for the ambulance service for help and there's nothing I can do. And sometimes you will have to just shake their hand, give them a blanket and watch them walk away.
I was fibbing. We found one for you.
You
want some water as well?
Yeah, no, I'm all right for water.
You sure?
Yeah, I'm all right for water.
Get yourself wrapped up in this.
Yeah, yeah, so I'm buzzing.
You okay?
Yeah, I'm all right, I'm all right.
You sure?
Yeah, I'm all right.
Last chance?
Yeah, that's right, I'm all right, thank you.
Take care. Don't you always feel like you should just do more?
Yeah.
I always feel so sorry for the homeless people. Like, we've got no idea why they are in that situation, and they get such a bad reputation. Like, he was a lovely gentleman.
And not every person in the streets is there because of drugs or alcohol.
No, exactly.
Some of them have had really bad upbringings of abuse and all the other demons that you can think of.
I think we don't appreciate as well sometimes, like, what is it they said? We're all 2 pay packets away from being homeless.
Yeah.
I think sometimes we do just need to remember that.
From homelessness to heart attacks, West Midlands Ambulance Service receives all manner of calls.
Has she had any blood loss?
Listen, just stop talking and listen to me.
In the control room, call assessors are on shift around the clock, making split-second decisions on who should get help.
I love how important this job is because we are on the first line. Like,
Before anybody wants to speak to the emergency service, they speak to us first.
Ambulance service, is the patient breathing?
Right, here from behind.
Okay, so car accident, is it?
Yeah,
Okay, is the patient conscious and awake?
she is, yeah.
Are you able to put the patient on the phone?
Yeah. Hello?
Hello, this is the ambulance service. And you said you've got head pain and neck pain, is that correct?
Yeah.
Have you lost any blood?
No.
No, okay. Is there any multiple swellings or any dark bruising?
I can't see it.
Okay.
Hiya.
Hello, this is the ambulance service. Who am I speaking to?
It's the husband.
I'm trying to go for an assessment with your wife. Are you able to put her back on the phone?
Yeah?
Okay, please stay on the line with me so I can get you some help, okay?
Yeah, that's fine.
These questions might seem irrelevant and they might seem silly, but to us, every question we ask, there's a reason for it. We need to ensure that we're going to get you the right help.
Right, I've arranged you some help.
But today, the pressure on the service is considerable.
May take up to 60 minutes before an ambulance arrives, okay?
60 minutes?
We will be there as soon as possible, though, okay? So a clinician from our service may give you a call back just to discuss the most appropriate course of action. So please ensure to keep the phone line clear.
Okay, I will.
Lovely.
When I'm telling our callers that it could take up to an hour for an ambulance to arrive, it does make me feel sad, but what I've got to remember is I've ruled out anything life-threatening, and it's not actually 1 hour, it's up to 1 hour. They also may get a call back from a clinician.
Just get to a safe place, okay? So if there's any new symptoms, anything changes worse, and you've got any other concerns, call us back on 999.
Although under significant pressure, it took just 7 minutes for an ambulance crew to reach the patient.
Are you calling about yourself or someone else today?
Me.
And what's the reason for the call today?
I'm out of breath, I'm panting, got my shoulder hurts and I feel a bit of a pain in my chest. I've got a bad heart anyway, I feel horrible.
Do you have a heart condition?
Yeah, I had a heart attack.
Do you have the chest pain now as we're speaking?
Yeah, it's like an agony, it's like a pain that just won't go away.
So now we've got a 66-year-old male. He's out of breath, panting, he's had some chest pain and previously had a heart attack. When we're sent to someone who's had a heart attack previously, we're looking to see if they've got problems with their heart again. We are looking for symptoms such as the patient being sweaty and clammy, having central crushing chest pain, pain radiating into his neck or down his left arm. Hello there, sweet. Are we here for you? Yeah, what's your name, Poppet?
Michael.
Michael, I'm Amelia and this is Nigel. Have a feel of your pulse, sweetheart. What can we do you for? What's going on?
Got palpitations.
Yep.
I've got a bad heart.
Okay.
66-year-old retired baker Michael had a heart attack 5 years ago.
How long's this been going on for?
About 6 this morning, me shoulder hurt.
Is that pain from your chest into your shoulder or is it a different type of pain?
I've got a bad back since Sunday.
Can I do some observations on your chair?
You might as well.
Can I nick an arm, please? Michael was sitting comfortably, not clutching his chest, which was a nice sign. However, we can't completely rule out that he's not having a heart attack without completing the relevant assessments. So, the pain in your chest, point to it for me, where is it?
In the middle.
And what does it feel like?
An aching pain.
An aching pain.
Oh, can you do me a favour?
What?
Can you get my lash brush out of...
Are you going to say in your bag?
Yeah.
We've been together now for 17 months.
Where is it? Whereabouts did you drop it?
Was it love at first sight? Probably not, no. Is he one of those that has to grow on you? Absolutely.
Oh, God, here we go. Oh, bloody flag out.
Like a bad smell, I just keep lingering.
Pretty much, yeah.
There you go.
It's got hair in it.
Ambulance services, patient breathing.
Yes, the patient's breathing, it's me. I've just been stung by a wasp and I've just injected myself with a needle, and where the wasp stung me, it's on my lips, so my mouth's been swelling up.
All right. Do you feel like you're improving at all after giving the injection?
I don't think I'm going down worse, but I certainly feel my lips swelling up.
Yeah, so you're not getting any better?
No.
So we're going to a 66-year-old male who's had a wasp sting, a suspected allergic reaction. There's no notes available. It just says rapid swelling of the lips. So it could be a potential anaphylaxis, this one.
Anaphylaxis can be a very, very life-threatening situation, and if we don't get there in time, we can make the difference between life and death.
I've actually been stung by a wasp twice. First time I got stung by a wasp, I was on a school bus.
On a school bus?
School bus. Well, obviously, yeah, 'cause I was on a school bus. I got stung right underneath my nail bed. My whole hand swollen.
No, no, no. Well, let's find a way in. Hiya. Okay, I'm Shawnee. This is Ian behind me.
66-year-old retired builder Michael rang for help when a wasp sting caused his mouth to swell up. His wife Eileen is with him.
I'm just going to have a feel of your wrist, buddy, OK?
Yep.
When I first arrived, I could see that his lips and his face were quite swollen, so at this point I was concerned about his airway. With anaphylaxis, things can change quite rapidly. So, tell me what's happened today.
Well, I was enjoying a scone with cream and jam, and I was joined by a wasp.
Oh, God.
And the wasp thought, I'll have some of that. Didn't
Yeah.
realise. Put it in my mouth, and obviously it bit me on the old lip there.
On the lip.
I had one exactly the same time 4 years ago.
Okay.
In the summer, in the back garden with a bottle of beer.
Yeah.
And that's when I knew I had to have they said you need to have one of these EpiPens. So
Was it an anaphylaxis reaction?
yeah, I had
Right,
okay.
OK.
Reactions.
OK, open your mouth nice and wide for me.
On the outskirts of Wolverhampton, paramedic Ian and technician Shawnee are treating Michael. He's had an anaphylactic reaction to a wasp sting.
How does your breathing feel?
Feels fine.
It feels fine, OK? You don't feel tight or anything like that?
No, I'm just slobbering at the mouth, that's all.
OK, bless you.
Did he sting you on the inside of your mouth, did he?
No, all I know is it's there somewhere.
It's there somewhere.
Somewhere. Whether it's in, I don't know.
While he's popping these obs on, am I OK to just have a quick listen to your chest? Is that OK?
Yeah, sorry.
No talking, nice deep breaths for me. Things we're looking for with an anaphylactic reaction is swelling of the mouth and throat. We're also looking for somebody's breathing rate and how their breathing sounds. It sounds nice and clear. I can't hear any wheezes or anything, so I'm quite happy with that. Have you had any Piriton or anything like that since?
No, the only thing I did was the old
EpiPen.
Michael injected himself with adrenaline from an EpiPen. The drug works by relaxing the muscles in the airway, making breathing easier.
The last time it was worse than that, but I think because of the EpiPen
I
being on
think
board,
the reaction of that
kept it
EpiPen
down.
has reduced it greatly.
Done its job, hasn't it?
Michael's fast reactions in using his EpiPen potentially did save his life.
I've been indoctrinated by this lady here.
Well, I wasn't here, and he said, I've been stung and I've given my EpiPen.
Yeah.
Okay. I said, right, ring 999.
Yeah. Have you got any Piriton? Have
I'll
you?
go and have a check. Okay.
And this is why I'm terrified of wasps. I really, really hate wasps. I am so terrified of them. It is unreal. I've never been stung before in my life, touch wood, and I am terrified that I would be the type of person that would have a wasp sting and have an anaphylactic reaction to it.
So, post-EpiPen, post-adrenaline that's been given, OK, you are meant to be monitored for 12 hours.
Right.
OK, so I think it's going to be a case of we will probably advise hospital, but you've got capacity to make the decision.
I'm happier to stay.
I will just get you to sign the board to say that you are going against our advice, and you're going to be stopping with him as well, so obviously if there's any problems or concerns, just give us a call back straight away.
Wife Eileen brings Michael some antihistamine tablets to help reduce the swelling.
Take one now, see how you get on. Hopefully the swelling should start to come down. If it's coming down and goes, then don't take any more.
Okay.
Yeah, and certainly don't take more than stated because you'll put yourself to sleep.
Do you guys want drinks? I know you're busy.
No, I'm good, thank you. We have been.
I'll just go on with cream.
We haven't. No. Does it come with a free wasp?
Yeah. I mean,
Thank you, both.
Thank you very much.
All right then. You're very welcome. All the best.
You
Take
too,
care.
take care.
Oh, they were lovely, weren't they?
That was nice.
Yeah.
Very nice.
Beautiful house.
Lovely couple, lovely house.
Now, this is why I'm terrified of wasps, because I would have full-blown anaphylaxis.
That's all right. We can treat it.
Yeah, but still, depends where you are at the time. If you're miles away from an ambulance, then...
Oh, in that case, I'll just carry a shovel with me at all times.
Sure. Oh, that's not nice. Don't dig my grave.
So I was there just to fight the wasps away, not for any other reason.
Oh, my hero.
Have you had anything?
Not 11. I took some aspirin too.
How many of those aspirin tablets did you take?
2.
2? Okay.
To the north of Birmingham in Cannock, Amelia and Nigel are with Michael, who's complaining of chest pain.
What were you doing when this pain started, mate?
Going.
Watching see just as you are? All right.
Do you suffer with angina at all? You do? Okay, sweet.
Angina is chest pain caused by reduced blood flow to the heart muscles.
Right, do you mind if I bob these on you?
It's not usually life-threatening, but it's a warning sign that Michael could be at risk of a heart attack or stroke.
Right, I'm sure you know the drill, but just keep nice and still, no movement, no talking. Just going to do your heart tracing. Looks all right to me.
Are you taking all your medication as you should do? Yeah, you're not missing doses or anything like that? No, brilliant.
Yeah, Nigel, I'm happy.
Well, considering you've had an heart attack before, your ECG ain't too shabby.
This chest pain, obviously, we can't completely rule out that it's not cardiac. Even though your ECG's showing that it's absolutely tickety-boo, we've still got to bob you up to hospital if that's okay. Yeah? Perfect.
Just before we do it, might drop your blood pressure a little bit, might give you a really bad headache. All right, but hopefully it will take that pain away. All right. Tongue to the roof of your mouth for me. Tongue to the roof of your mouth. That's it. Sorry.
This spray is designed to widen Michael's blood vessels, reducing the risk of a heart attack.
Got a big old transport collection here, haven't you?
Oh, fine. Nearly 1,000.
Really?
I thought it was quite an impressive collection of trucks in his house, to be fair.
It was, and he had loads.
He had a lot. Covering pretty much every wall, weren't they?
Yeah. Look at the little bag. Are these all second-hand then?
Oh, no. Someone
Oh, are they?
Okay.
Pretty cool.
How's that pain doing now, mate?
Eased a bit.
Eased a bit. What would you score out of 10 now?
6.
A 6. Well, at least we're coming down the right direction. Hope that the rest of that aspirin will kick in.
Right, yeah.
Right then.
Let's hit the road.
Let's
Hit the road.
Hit the road.
It's difficult outside of hospital to 100% determine what's causing that chest pain. If it's your heart, they have to do a blood test that looks for a protein in your blood which would indicate your heart's under stress, which we can't do outside of hospital.
Once again, Michael is attached to an ECG machine, so Amelia can monitor his heart on the journey to hospital.
Right, are you comfortable? Yeah. As much as you can me anyway. We're ready to go. Hopefully, your bloods will come back nice and clear, and then you can get your send back home.
Michael arrives at New Cross Hospital in Wolverhampton.
Right, let's unclip you.
Here, doctors will want to run further ECGs and blood tests to look for any signs of a heart attack.
But he's a lovely chap, wasn't he?
Yeah, he's not a chap, and all those models as well, but pretty cool.
Apparently he's been collecting them since the age of 4.
Since the age of 4?
Since the age of 4, that's what
Wow.
he said. Yeah.
I don't think I've got the commitment to go that long to collect anything.
No, me neither.
Just collect a few more years every time we go along. That's the only I collect consistently.
In hospital, Michael's blood tests showed he hadn't had another heart attack. Cardiologists thought the episode could be stress-related. 5 hours later, he was back home. David, who collapsed in his garden, was in hospital for 7 days. Blood tests, scans, and x-rays were unable to identify the exact cause of his seizure. And golfer Pat, who fell injuring her leg, was back home the same day.
When I got to hospital, I had the x-rays on my leg and my wrists and nothing was broken. All this was like raw muscle and whatever. I've just got to wait for the skin to grow back over now. It just takes time.
Pat's been playing golf since she was in her 30s.
I just go up and practice my putting because I don't have to do any strenuous stuff on my leg, so it stays good. All improves.
Next time.
He is obviously bleeding with clots, and we don't like that. It's not very good.
An elderly man is bleeding heavily.
He was quite pale and he was breathing very hard. This can be a sign that his body's compensating for blood loss.
A woman is in agony after falling in a supermarket.
Try and keep it as still as you can.
Could well have been the humeral head that had either fractured or she'd dislocated her shoulder socket.
And paramedics are called to a road traffic collision outside a school.
How do you feel now you've moved?
Trembling.
Trembling, OK. Let's get you in the warm.
A fracture to his neck or spine can cause life-changing injuries.